This conference will now be recorded.
Whoa, this conference will now be recorded. But from what I understand, it's going to suck a little bit after getting the vaccine too. So you're going to feel a little crummy. That's generally the consensus, and that's most everybody. But the point is that, or at least the goal is that not so many people will be dying. They just might be a little bit miserable for a day or two.
That's what I heard.
And also,
and if you happen to get the flu, it is not as serious as if you had not had the vaccine.
Correct.
Right.
Yeah. Right. And same thing with the pandemic, the COVID thing. So so it's if it's 10%, what they say, 90% effective, I think is what I'm hearing.
Something like 95, 96%.
I think I've heard. I think the one in England, the one that they've approved in England, they are saying 90 is what they're saying. But regardless, I mean, so let's just say 10% of the population say that they get it. But again, it has been shown, hopefully, that it will not be as severe as if they.
They're saying here in California, they're going to start vaccinating like just in the middle of the month. They're healthcare workers and first responders.
Wow.
And people with cancer and old people are the next line. It'll be interesting how they organize all this.
Yeah, I'd still suggest you ask your own physician because they know your type of cancer.
Mm-hmm.
But I keep hearing different viewpoints from different doctors, different from CLL, AML, and lung cancer specialists. I've asked them all the question, and I get different answers. Some are in one camp thinking it's fine, and then there are others who say no, and patients should wait. But Richard, have you asked your doctor before Tom weighs in with the answer at the end?
Have I asked my doctor about the COVID-19 vaccine?
Mm-hmm.
Yeah, no, the answer is I have not. Some general speculation about the decision making with regard to who gets what first. And, so we've had some fun talking about that. It's not clear to the Maine Health Department or what our CDC is here that what that priority is going to be, regardless if it comes out of the folk in Washington. Because as I understand it, the local folks have the decision making in terms of prioritization and process.
Yeah, so the CDC recommendation has been that healthcare workers and residents be the first group. As Richard said, it is states to decide whether or not they accept the recommendation of the CDC. And it's kind of interesting that blood cancer patients are among the first to be immunized so they prioritize people like us that have blood. So I don't think we're going to be right in that first group. So one of the interesting things will be to see what happens with people that have CLL or other blood cancers, that earliest group in the UK. So they're talking, giving the jab as soon as next week. So call them a shot. For some reason, everything in the UK that's a vaccination is a jab. But I think that will give us some opportunity as a pharmacist. I always kind of err on the side of caution. I like to see that a drug for several months, not clinical trials, if possible, before I consider bringing it into the hospital. And so I'm kind of holding back, but I am in conversation with my specialist. Next appointment is 2 weeks from today, so I will ask him to see what his thoughts are. And I'm also going to be interested to see what comes out of ASH starts tomorrow, and there's a lot of COVID discussions on the agenda.
So, Tom, we're having a little breakup with what you were saying. I don't know if anyone else was experiencing that. So could you repeat, I guess it would be your summary before ASH. There was a bit of breakup, I think, and you were saying something probably pretty important that I missed out on. And then we can explain what ASH is to those who don't know.
Yeah, so what I was saying was that, you know, as a pharmacist, I always had a rule of thumb that, you know, when a doctor asks for us to add a new medicine in the hospital, I'd like for it to be out 6 months minimum before I would consider adding what we call our drugs that can be used in the hospital, just for safety reasons. You know, only 40,000 roughly have been in each one of these clinical trials, and we're talking hundreds of thousands and millions of people that are going to get to see what side effects really happen, you know, what's the safety profile and that kind of thing. So, you know, I'm not in a big rush to get it, but I won't be one of the last ones to get it either. You know, if there's good indication coming out of the UK. You heard the part about where I said the UK has prioritized blood cancer patients, correct? Okay, so in the UK, they start vaccinations next week, and blood cancer patients are among the first to receive it.
Tom, what was the reason behind that? It's not something that we've heard in this country.
Yeah, well, you know, I don't have a lot of information about other blood cancers, but the mortality rate among CLL patients exceeds 30% if they contract COVID. So, and in the UK, those patients have been sequestered the entire time. So they've been under lockdown. You know, they had a lockdown, got off the lockdown, went into another lockdown, but CLL patients and other blood cancer patients have been advised not to go out this entire time. So since like February. So it's been really life altering for them.
Sure. Understand.
And I just want to confirm that, yes, inoculations and vaccines are jabs as opposed to injections or shots.
Yeah.
Especially considering, depending on who gives it, right?
Yeah.
Exactly. You know, it's pretty primitive. You know, they stand like 6 feet away from you and throw the needle like a dart, you know.
I don't know if anybody else has gotten it, but I've had the air gun in basic training where they just line you up, one, boom, 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 and it's just, that's all. There's no
Now,
needle.
look, we have to welcome Susan, who is in Canada, so that's halfway between a jab and a shot, right?
Yeah.
I've had it through MEPS, Tom. MEPS does the thing where you could ka-doom, ka-doom, ka-doom,
Yeah.
ka-doom, ka-doom, ka-doom. Jeez.
Sorry to be late, but I got
Well, we're
here.
glad you're here.
Better late than never.
Well, Susan, since you're late, we
I'm
volunteer
Canadian.
you first to get the vaccine.
Oh, well, I had a flu shot. That's as far as I'm going.
So
Well, I'm curious. So there seems to be some negative feelings about or distrust of the vaccine. I'm curious. What is that?
Our provincial government has spent millions and ordered lots, but they're still trying to decide who gets it first. So right now they're worried about just testing, like for teachers, that like who gets to be tested more so than the vaccine.
Mm-hmm.
You know, we're always a little bit behind you guys. That's the way it is.
I don't know about everything. There are a few things you're way ahead of us on. So.
Oh, like chocolate bars or something? No.
Well, I mean, the number of that Americans that want to that we're talking about some sort of mass exodus leaving the country over the past few years. So,
Oh, that's true. Yeah.
And you didn't want us.
Oh, well, maybe, I don't know about the majority, but personally, my husband has just actually hired an American. He's just finished on Monday his 2-week isolation, and he's come up here to work with my husband. So
He
not
might,
all of us.
he can have he might live to regret it though, Susan. Might.
Well, we'll see. I'll let you know.
Hey, I have a question for the group. Something that's certainly floating around in a lot of the literature that I've seen lately, and that's, with the holidays approaching and Thanksgiving, perhaps not in Canada, but having come and gone, and other holidays, some of which are civil and some of which are religious, that are fast arriving, and lots of questions about how are we going to handle that? How are we going to handle that? In my own family, it's a time when the children and the grandchildren would get together, and we've kind of all struggled around that because they're relatively local. But on the other hand, have you thought about that? How that is going to play out in your own families and yourself, since these are usually holidays filled with lots of sentiment on the part of people. I'm just kind of curious.
In our case, here in Texas, since we're so close to having a vaccine, at least I think, in maybe a couple of months, I'm willing to forego seeing the grandkids and the kids till February or so.
Uh-huh.
At least let them get past the Christmas season, the holiday season, and any infections they might pick up. Maybe we get those and get them past them. It's bad enough just to go and be with them and get a bad cold from them.
Yeah, amen. Amen to that.
True.
Well, to follow up on what Richard was saying, does anyone else have any thoughts about what they're doing on the holidays? I know
We're in
personally,
lockdown
yeah, we are too.
until December 11th, like the whole province of Manitoba. For those who don't know where I am, I live in Winnipeg, which is southern Manitoba, I guess, central. And we're on lockdown till the 11th and possibly longer. Our high school kids, grades 7 to 12, are going to have an extra 2 weeks of online school after our winter break. And like right now, like lockdown is, we're not to let anybody in our house, So actually, just before this, that was part of why I was late, is my Navy son who just moved to Winnipeg in the summertime. He came with my 2 grandkids and brought us hot carrot cake.
Oh, how
So
nice.
hence
How
that,
nice.
the tea and the carrot cake. But he's military, so he didn't. And coming from the West, they didn't have to quarantine. We only, what is it? Terrace Bay, somewhere east of Kenora, Ontario. We don't have to quarantine. But from Terrace Bay East, if the people from there come here, then they have to quarantine. And the fellow that Dave's hired, he came from Illinois. He had to quarantine. And we're probably, well, we don't know. We could be looking at Zoom Christmas.
Yeah.
Your son, when you said quarantining, I meant personally we were not where I live, but so did you let your son in the house?
No. No, we didn't, because, you know, the other thing is that our government wants us to tattle.
Yeah.
So I'm only on a little bay, 5 houses. But we went out to the driveway and talked to the, you know, and
So
with our masks on, and just kind of visited it with the window down.
so your neighbor could have blown the whistle on you if you didn't tell?
Well, they could. Hopefully not. Maybe there's no, I don't know exactly who's home, but they are encouraging tattletaling.
That sounds.
And there's a good sized fine for, like, we're supposed to just isolate by ourselves within our just family. Like, no more bubble.
Sounds
Like,
pretty
say,
scary.
at the end of August, we had a family bubble, which included my 3 children, their spouses, 6 grandkids, and we were getting together. I think we can still go outdoor, like be out. That's why I went outside. We can be outdoors, because last week we went out to, is that still true, Dave? Gatherings of 5 only outside. Can you see my husband back there? Well, he's doing his online thing.
Susan, what kind of blood cancer do you have?
I have CLL. Well, technically, I'm watch and wait for another little while. Michelle, it was so good. Michelle and I were texting while I was waiting to see my cancer doctor today. And it was just so supportive that I can't even thank you enough.
Oh, it's my pleasure to help. And how did you wake up today?
My numbers went up again. So, but she wants me to have blood work in another 6 weeks. And then from there, I'll probably be looking at treatment within the next 3 months. So I have this sheaf of papers.
So I have a, oh, sorry, go ahead.
I don't think I can put it so that you could read it. No. The first one would be a 6 month for 6 months, partly IV, partly pills. The next one's ibrutinib, and the next one is something. It's some echo. I don't know. It's ibrutinib, but with another word in front of it.
Could have been a calibrutinib?
Yes, that's it.
I'm
trying to read her writing and remember.
Will you be on, Susan?
Pardon me?
Is it a trial that you're going on to?
No. But she did say that one with the acalabrutinib, they only have, in Canada, we only have 2 years of documentation or whatever, like 2 years of data on it. So we're probably going to do the 6 month thing and then see what that does. And then my next option when that, I don't know, doesn't work anymore. I don't know the technical terms, but then the next one would be the ibrutinib.
Susan, on the 6 month, is that the FCR, the chemo?
Right.
Or the beat? Okay. Are you mutated?
No. Okay, that's the other part. No, I'm unmutated.
Okay. It's not. Go ahead, Michelle.
Unmutated IGHV, and then I can hardly read it, but I got a bunch of stuff to read about it. So it's bad to be unmutated, right? Or it's not as good to be unmutated?
Yes.
Well, it depends on what your treatment is. It's not as successful for FCR if you're unmutated. And
Okay,
also,
so
also if you're 17p deleted, it's not as successful. So,
they wrote down no PS3 mutation or I think that's P53.
yeah.
No,
TP50.
no P53 mutation. And then she wrote unmutated. So I got all I know is that my numbers are going up and up and up. Like they went from 90 something to 121. Does that make sense?
In how long of a period?
6 weeks. Because
What,
I was
what-
supposed to go, I was supposed to see her on the 19th, the same day that there was a seminar or webinar about getting treatments on patient power, I think it was on the 19th. And then I was notified she wasn't going to be at the clinic that day. And so my appointment was changed to today. So I'm still kind of, she said something about this. Okay, so what's the one with the short word in front of ibrutinib? It's very expensive, she said.
Calibrutinib or zanubrutinib.
What is it? It starts with an A then, acalabrutinib. But apparently there's some kind of, perhaps the drug company has compassionate access. See, it's a whole different ball game between how you guys have your health care and whatnot and what we have here. So like it's all I can do to just figure out these words. But I guess we're leaning towards the 6-month treatment. Any comments on that? I don't know if that's a good thing or a bad thing, but.
And you said that you're unmutated?
Right. I got the impression that she thought that was the best option, was the combination of the IV and the pills.
And the FCR. I was on the trial for the.
When you say that, so it's really hard when you don't give us names of drugs to be able to give you help. So
Well, I'm trying to read this. It says,
is it venetoclax and obinutuzumab?
There was something with.
Okay.
I know, I got the one sheet here. I got so much paper, you guys. Where's that other stuff?
It's interesting to know that venlafaxine is used for multiple myeloma too,
Yeah.
but only for transfer T1114.
Okay.
Okay, cool. Okay, so one is information on ibrutinib and side effects and then my other background chronic illnesses are fibromyalgia and chronic fatigue. And a lot of the side effects are what I already have from my fibromyalgia.
You know, it's kind of interesting that there's a lot of patients that are CLL patients that also have pre-existing fibromyalgia and chronic fatigue.
Really?
So, I think it's definitely an area that it manifests earlier in that form in some patients. I'm not sure that there's a lot of research on it. But
so I think it's a combination of the ibrutinib and obinutuzumab. Oh yeah, that one. That's Gaziv. What I guess most people refer to it as Gaziva.
Yeah.
So that's
one.
what she gave me
Okay.
information on.
And that's what she's saying would be 6 months?
6 months, right.
Okay.
And then see what, I guess, so then that's hopefully would bring me to remission for as long as that lasts, and then I could go on ibrutinib again, or the one with the
The
one
Acalabrutinib,
with the short word in front of it.
yes.
What did you say? Acalabrutinib?
Okay. I can talk if you let me talk. Acalabrutinib. Okay. It's not ibrutinib. It's acalabrutinib. And it's a newer version of ibrutinib. So they're basically the same. There's less side effects with the newer one.
Oh, yeah, she did say that.
Yeah.
Well,
Susan, in the chat, I sent a note to everyone, but it's a recommendation from Dr. Brian Kaufman of the CLL Society, and it's a good one-page sheet to look at for recommendations before you treat. And you might look at that and print it out and take it to your doctor for discussion.
And Susan, so that would be good. And I know that if you would like to continue talking about this, so we can give some other people a chance. Tom and I would be happy to engage with you offline this week or next week on this as some of it settles in.
Sure.
Because I'm sure today is a very difficult, or tonight, because you just got back home from learning all of this, and this is the right place to be.
Yeah.
So I know that when we were talking, Tom had more to share with us about the vaccine, and we kind of got into another topic. But on the vaccine, Tom, I believe you had a few more things on ASH, with ASH coming up, and that's the American Society of Hematology. Oh, my wine has been delivered. Thank you. By the FDA.
What a great butler.
Thank God. It was FDA approved.
Yes.
Of course, for Canada, it doesn't really matter, but for those of us in the States, cheers.
Cheers.
So ASH is I don't know, it's kind of like the pilgrimage every year of all the great hematologists to discuss their findings on their research and to release all the information about what we have, about what their research is showing, and the latest and greatest. And actually, there's been a lot of hope for more and more treatments for all of us. And I know that's where Tom and I actually met in person. We've known each other from online. That's where we met a year ago. Tom, it's our anniversary.
Yes, it is.
And so there is going to be a lot of discussion, I noticed, regarding COVID and patients. I mean, well, also the vaccine. And Tom, are you attending any of those sessions?
So I actually got press credentials, so yes, I will be. So because of my blog, I was able to qualify to get press credentials, and so I will be attending. So
that's great. I'll be attending some specific ones myself, sessions for patient power. So I guess I'll see you on.
Where is it being held?
it's virtual. It was supposed to have been in San Diego. If it had been live, it would have been in San Diego.
That would have been nice this time of year.
Yeah. The first one that I ever went to was in 2018, and that was in San Diego as well. And, it's interesting because that's where I first learned about the combination of venetoclax and ibrutinib that I wound up being on. And so that's what kind of got me started doing research and learning about, that combination and what the promise was. And so I think I've talked to you guys before. I started, I've been on ibrutinib since 2016. In February this year, I added venetoclax. And on Veterans Day, this veteran got the great news that my clonosec test came back that I am undetectable MRD down to 1 in a million. So essentially, in total remission. So that's really, really good. So I I have an appointment in 2 weeks with my specialist, and we will have a conversation about what we're going to do going forward. But I'm hoping he will say I can have a little drug holiday for a while, and that would be really good. So, there's a lot of hope out there, and there's a lot of new combinations coming down the road, and that's the kind of stuff we learn about at ASH. So I was able to advocate for myself, to go on that treatment because it's not approved anywhere. But my doctor says, well, if your insurance will pay for it, I'll order it. And sure enough, I'm retired military, and so TRICARE, which is our military insurance company here in the US, said, yep, we'll cover it. They approved the same day. And so I pay $33 a month for each one of those drugs. And in a little over 6 months, it wiped out all the cancer. So very, very positive. But ASH is, I think it's like the premier conference of the year. The biggest amount of research and presentations on what's going on, all the latest data. There's a lot on myeloma in there. I don't really understand myeloma that well, but in some of my downtimes, I may actually jump in and try to learn a little bit more about myeloma and what's going on. I know there's a lot of interesting things going on with myeloma.
I'll send you some links.
Okay.
So, yeah, I know that it always makes me very hopeful when I hear of all these different combinations, but Tom, that's fantastic, especially your 17P, right?
I am, yeah.
And who would have thought even a few years ago, right? Undetectable MRD. I don't have that. I never reached that. So congratulations.
The old standard was they would look at 10,000 lymphocytes and see if they could find a cancer cell. And now with this new technology that just was approved by the FDA within the last 6 months, they can look at 1 million. And so they don't say there's 0, but they say there's less than 1 in 1 million.
Yeah.
So
I'm also MRD negative.
yeah,
Oh, that's fabulous.
yeah.
That's something that's common between our cancers. I don't know. Do they test SLL for that as well?
Yes.
For MRD negativity?
Yeah.
Okay.
Essentially, CLL and SLL are treated exactly the same. Drug treatments are exactly the same for both.
I've got another video call. Sure enjoyed it. I'll be back.
Thank
All right,
you.
Lynn.
Good night.
He coming back.
That's great. Speaking of which, we did have our newbie last month promised they would be back. And they actually sent a note saying that they couldn't, which is amazing, but they will be with us next month. And we had another gal, she's an AYA patient, an additional one to who we already have. And she wrote, she had planned on coming, but she's in the hospital. And I said, don't worry. You don't need to sign on, and she still may join us sometime, but it would be pretty late if you're in the hospital to be joining us because we have a late night crew here. So Lynn, I don't know if you realize, but you're still here. I don't know if you still wanted to be with us, but getting back to our conversation. So the holidays are coming. Did everyone sequester for Thanksgiving? I'm just curious. I know that my husband and I, it was just us and the chocolate lab. It was kind of lonely, but in a way, kind of nice, actually. We had a ton of Zooms with family all over the place.
Yeah, we mostly did just me and the kids. And of course, I did all the cooking, so made just a big giant meal. And but normally we have lots of friends and over that who are in the mountains, either short timers or kids whose folks are doing this, that around, and so that was kind of weird not to have the big giant crew of kids and family sort of coming through. And oddly, I bought a 18-pound turkey for 5 people. That was a bit much.
A little bit of leftovers.
That's a lot of leftovers, huh?
Yeah, I mean, I made a whole thing of sweet potato casserole, a whole thing of green bean casserole, stuffing, and I mean, I did the work, did the giblet gravy, I did the whole thing, and you know, I think I had enough for about 3 times the number of people that we had. It was pretty ridiculous. A pumpkin pie and a pecan pie. Got a hand.
See, our Thanksgiving it's the beginning of October, so I think it was around the 8th. So at that time, we weren't locked down, so we were at my daughter's, all of us, so that was wonderful. So we, you know, it was kind of like we were just starting to enjoy being with the family, and then all of a sudden our COVID cases numbers are up and up and up and up, and so now we're back to lockdown. Kenny, are your girls all both okay now?
Yes, thank you for asking. Well, they're getting there. Thank you. Good memory, Susan. So the one with encephalitis she recovered really fast. But of course, the one that tore up her knee, the ACL surgery, well, it was ACL, MCL, and meniscus surgery. So she's got a bit of a rehab time now. So she's finally out of her brace. So she's just walking funny now. And she looks kind of like one of those bobbing birds that's always like going for the water. It's kind of how she walks. But yeah, so she's getting there. And of course, it doesn't help being 16 years old and in your life being, you know, up to this point, really, well, largely being identified by playing soccer, and then suddenly you can't see your friends, by the way, because we're during a pandemic, and you can't go to school because we're in a pandemic. And so, yeah, that gets pretty dark and depressing at that age, at any age. I don't like it either, but it's tough. But thank you for asking.
Well,
You're welcome.
Kenny, I didn't realize that. Was that from a bad tackle? Is that
Yeah, so what happened was she got in front of a defender. She was playing wing and got out on the outside, and so Maggie actually got around her, got the ball away from the girl, and so the defender was trying to sort of play catch up, and she lost her footing, and so she pushed Maggie, no big deal, and Maggie hit the ground. Again, no big deal. When she hit the ground, though, the girl's knee planted on Maggie's calf, and then Maggie's body rolled.
Yeah. And she rolled, and she ripped the. Oh man.
Yeah.
I'm so sorry. You know, that's a tough injury, even for a professional soccer player to come back for it is really, really hard. And you know.
Well, we've talked to a number because this is a recruiting year for her, and so she's looking at Division I schools, and so that's a tough one. And so we've got a lot of video footage, but you know, she's missed. So this is meaning she's missing 3 soccer seasons basically. She's missing spring, fall, and then the next spring. So because she missed last spring because of COVID, they didn't have any of the ID camps or any of this college things during the summer. None of them had them. So and now they just found out today that the girls that are still practicing and playing, they have to wear masks while they're practicing and playing. So games, they have to wear masks during the games. So
we have to do that too. Most of our sports though, like community club sports, it's all canceled. Like there's nothing going on. But if there is anything going on, they've got to wear masks. And our gyms are closed. Everything's closed. You can't even, actually on the news today, we have, like, you can go shopping, but only for essential items. So our kids are still in school, right? But school supplies are not essential. So it was on our news tonight, like there's parents saying, well, like my kid needs a poster board to do a project because she's still in school and I can't buy it anywhere. Like, because that section of the store is like shrink wrapped. You know, like that's what a lot of the stores have done is they've kind of like shrink wrapped the bunks of where these things are. This COVID is besides being a terrible health thing, it just hits, you don't even realize how many things that it affects.
Hey, so just kind of related to that, there is this ongoing controversy, and I know that we've talked about it in prior meetings. And that's the whole mask wearing issue. And I'm curious what you think about that. I'm amazed that some people would actually not wear masks out in public, and I wondered what it was about. What are your thoughts?
I
In
know,
California, oh, sorry.
no, go ahead, Sally. Would love to hear from you.
I was just going to say in California, the people who don't wear masks feel that the whole COVID thing is a hoax, that it's no worse than the regular flu and, they're invincible and it's really horrible. And
So
there have been a
even
lot of
with-
fights on the streets.
but even with the death numbers that are extraordinary in this country.
Well, the death numbers from a standard regular flu are about 18,000 a year, but it's not put in your face every day. And all this started coming in April when the death rate wasn't as high. But, because the numbers and everything are thrown in your face every morning, first thing, it's, a lot of these people feel that it's a hysterical reaction to the media.
Well, so we don't want to get political here, because we try to be very agnostic.
I didn't say anything about politics.
You,
But
you don't have to. That's the problem.
you live in sorry, I know you're not from Florida. I don't think you're like a gypsy because we're in the military. You've lived everywhere. So you're in Florida though. That is such a hotbed and has continued to be. And I see, as an example, pictures of my friends from when I lived there. They're all out as if nothing's happening. Are there any kind of mandatory rulings or people getting better about that?
So I've seen an improvement here in mask wearing in the last couple of weeks. It used to be that if you went to the grocery store, you could always spot a half a dozen people that used to wear a mask in the grocery store. I mean, I just, avoid those people. But we're pretty, we're not in a lockdown. We really have very few restrictions. And, our rate is not at the high point that it was. It's actually come down. So, Florida's kind of a diverse state with a lot of really rural areas. And I think that, what applies to Miami doesn't apply to my little county here, 40 miles north of Tampa, and so it varies. I did notice that, I traveled up north during the summer and compliance with masks and stuff. The further north I went, the better the compliance got. I think primarily because they got hit hardest early on when the death rates were really hard. Now we've gotten to the point where we know how to deal with these patients and we know what we need to do to keep them from dying, and we have these new treatments available. I just got a message from a CLL person that turned out to be positive for COVID and got offered the new antibodies that Eli has. And she wanted to know, did I think she should take it or not? And I said, absolutely, given the risk, that we have for mortality. So, not as many people are dying as, in the early days, and primarily because we now know how to treat it better and we have more options available to us. So I think it's, it's interesting. I find it really ludicrous that you would tape off the school supply aisle. So that's what it is. The meat aisle, that's no problem, but the school supply aisle, it's like either the business is open or the business is closed. What difference does it make if it's a school supply or you go in to buy? I mean, is beer an essential item? I bet it is. You know, that's
Liquor
Damn right it is.
yeah.
Liquor stores are cannabis
Yeah,
stores,
CBD.
whatever you call
Yeah.
them. There's another one.
I mean,
Now,
that's
now,
essential.
now it just got interesting. Okay.
yeah.
What's interesting?
Well, so in Massachusetts, our numbers are higher than they were in the spring. And I mean, we're up north,
Ours too.
people have gotten better. I mean, people were really good about wearing masks, and I do think a lot of people, what they're claiming, what they're saying out there is they got COVID fatigue. And personally, I understand it. But I also know I have to be extra cautious. If I didn't have CLL, I don't know how, I really honestly can't say. I would like to think I'd be wearing a mask, but maybe I would be more adventurous. I don't know.
I'm ashamed to say, I mean, you're absolutely right, Michelle. I mean, there's this fatigue like that we're all, I assume that we're all experiencing. I was more cautious in April than I am now, much more. And we hardly had any in the whole state in April. I mean, like North Carolina was pretty low, and in the mountains in North Carolina, in April, I think we had 6 cases in the county that I'm in. So yeah, and now I mean we've got thousands. So and so it's yeah, it's pretty nuts, and they're starting to tax our hospitals up here as far as the number of people that are hitting the ICU.
You know, I heard in our neighboring state, Rhode Island, what is it, the biggest small state in the union or whatever. I think that's the saying since it's the smallest state, but they don't have any hospital beds left. There are no hospital beds to be had, which this is right over the border.
Same here.
It's really, it's when I hear that, it's scary. And like you said, Kenny, although I'm trying to get, I have not been even outside at a restaurant, I will say, but there are a few things here and there. You know, I was doing, I went to the hair salon a couple of times, did not get my nails done, but I did get my hair cut recently. And I was just like, and now with the numbers going up, I probably won't be doing stuff like that, or, you know, running into the hardware store will probably be off my list for a little while again. Maybe, probably. I don't know.
At some point you have to get your nails done, and you have to have tacos. I mean, it's just, there's things that you just have to do. So the real question is how do you get tacos and get your nails done safely? That's what's important.
And you have to wait in between that so that you don't mess up the nails once you get the tacos. So,
But Kenny, we are
You do those on the same day, right?
by the government that wearing face masks and keeping social distance is the primary way that we're going to do battle, if you will, with COVID-19.
But you can't eat tacos with a mask.
But you can't. But and you have to move your mask up a little bit to have the beverage. But you know, it amazes me that people wherever are looking around and saying, "I don't have to wear a mask. I don't like how they look. I don't want the government telling me what to do." And yet the data is pretty significant in that, you know, we're told that this stuff works. I don't know. I don't.
Al, we need to hear from Arizona on this issue.
Yeah,
Right.
well, we have here at all the stores, Home Depot, Walmart, hardware stores. As a matter of fact, yeah, well, there are signs on the doors that if you don't have a mask, you can't go in.
Right.
But you'll still have the people that go in there Now, the employees don't have the right to confront those people. They still walk in. So you're in Home Depot and you might get 1 or 2 people walking around without a mask.
Well,
And that's everywhere. I drove through a drive-through coffee place a while back, and the girl at the window, she told me, and I had my mask in my truck, but I'm going through the drive-through. She's got her mask on, and she yells at me, "Put your mask on." So I had to put it on for her to open the window,
Yeah.
which I just forgot. I would have put it on, but yeah, and then a while back I was at the grocery store and I'm in line 2 different times, same grocery store. And I'm at the counter now paying for my stuff. But before she starts ringing me up, the cashier asked me, "Is she with you?" The lady behind me. And I said, "No." And she scolded that lady and said, "You need a social distance now and get 6 feet back." And that was great. Now, another time I was in there, there's a younger kid, but pretty, he's bigger and taller than me. And I was just so close. I mean, my blood pressure's going up. Like, this guy's right up on me. I'm getting ready to pay for my stuff, and he walks right up on me and everything. And I'm looking at security, and he's watching everything. And so I pay for my stuff, and I go to him, and I go, "Did you see what's going on there?" And he goes, "I saw it." He says, I saw you. He says, I could see, you were running out of patience, but we're here just to keep the peace. I can't say anything."
what? What? The
Yep.
security guard couldn't say anything? That's outrageous. Did
Yeah.
And we have
you say
extra
anything?
people.
Would you
They've
turn around and say anything?
they've hired extra
Al?
people here to police the mask wearing and distancing, like all that stuff. Our restaurants aren't open. Well, they said 25%, but most of our restaurants are takeout. But I think you're going
Same
to
here.
find almost anywhere there's going to be some who don't want to wear a mask for any number of reasons. My son, the pharmacist who works at our second largest hospital, he's not in favor of masks. So like we try not to talk about that because he doesn't think that masks do anything. And he's somebody who has to wear it all day long at work.
I'm curious as to why he thinks that, Susan.
He's done a lot of research on the internet. He sent us something that he just doesn't believe that little bit of fabric is really going to do anything. He actually says he scares the living you know what out of me because he wants to get COVID and be over it. I guess I don't know, like, is it because he's working in the hospital and exposed all the time? Like, I don't know. He's a pharmacist in the dialysis unit. So I guess like he sees these incongruous things going on. Like he says, in order to get these patients that have COVID from where they are to where they're going to isolate these COVID patients, they're taking the gurneys right through some other ward. I don't get it myself, really. He doesn't really think the masks do anything unless it's the N95 ones.
Well, again, they're not supposed to necessarily only protect him, and it's not foolproof unless somebody's wearing a hazmat suit and they're getting decontaminated every time they walk into a room. Sure, it's not absolutely 100% preventing it. That's not the point of them. It's to reduce the spread, because this stuff is airborne, and so the larger it goes, more likely it is to spread. So as long as it's contained in this area and people maintain a safe distance, that's the purpose behind it. Yes, it would be ideal if we could have everybody just completely isolate in their little bubble for 2-3 weeks and then move on. But that's not what the point is. We don't have those resources.
I have the N95 masks, and they have the little port on the mask. And I didn't know this, but when we went up to the Mayo Clinic, they stopped me before I went in and said, you need to remove your mask or put this one over it. Well, I got the other one and I put it over it. And some places don't know of this and some places do. But I did not know of this, is that little port, whatever you're breathing or exhaling comes out. So if you're around someone that has a mask that has the port, they don't have a mask on.
Yeah, stay away.
But nothing goes in. It protects you from anything you're inhaling, but it's not protecting the other people from what you're exhaling.
Correct.
So I think I had a crazy experience. One of my friends, it got closer a few weeks ago for us in that one of my friends texted me that she had COVID, and luckily sometimes we go for walks together. Luckily we had not been on one for a while, and she and her fiance lived together, and basically the doctor said he doesn't even have to bother to be tested. He's got it. And she's telling me in one breath that she has a horrible headache still, and that he's coughing, and in the next breath she can't stand being cooped up anymore, and she's going to go out and do errands. I'm like, but you have COVID. And she said, oh, it's been 9 days, and the doctor told her after a week that she wouldn't be contagious. Long story short, my husband went to Whole Foods and told me he ran into her fiance. And my first question is, you didn't go up and shake his hand, did you? Or fist bump or anything? And he's like, well, no. And I said, did he have on a mask? He said, of course, you have to have on a mask in Whole Foods. And I said, he has COVID. But they had it, at that point, it probably would have been, I don't know, 12 days once she had been diagnosed. So stuff like that really scares me. Tom, can they still be shedding?
Yeah, there was actually a case not too long ago of a person that had it for over 5 months.
Wow. Wow.
Yeah. So, yeah. Now that probably was a person that had some kind of, compromised immune system that they weren't able to clear it, but yeah. And this was from a reliable source. This was not from, the newspaper or on television. This was from a medical journal. So, yeah. So yeah, we don't know how, that's part of the problem, is we don't really know everything there is to know about this. I mean, I think we're better off than we were when this first started in February or March, but we still have a lot to learn, and the vaccine coming is, I think, will be interesting to see. So, I think one of the things, as I mentioned earlier, for us as CLL patients, it will be really good to see what that experience is in the UK, where they prioritize people with blood cancers, and that'll help for us to be able, because we're not in that first group here. So I would say we're probably going to be like January, February before we get offered it. And by that point, there will be more people that will have received it. So if there are any problems with it, we'll start knowing, pretty soon thereafter.
Yeah, I'd like to bring something up before we run out of time here. But back to the COVID shot, and again, the flu shot. So I got the flu shot. 2 weeks later, I got the symptoms, and in the past years, I've always gotten the symptoms from the flu shot. Now, to this COVID, we don't even want to get a little bit of it. I don't know how you guys feel, but I don't want no part of this at all. So I mean, I mask up. I got the Lysol wipes. I got alcohol. I got gel. I got everything in my truck, and I come in and I wash my hands. I wash my hands all day long. So now, let's say the vaccine comes out. We go get the vaccine, we're first. Now, we don't know how bad the side effects are going to be on us. I mean,
so yeah,
if I got the flu-like symptoms from the flu shot, I'm getting COVID now.
So one of the interesting things is that this is a totally new technology for this particular vaccine. So it's a messenger RNA technology. So, all the other vaccines we have, they inactivate the virus. So we have some virus vaccines that are actually a live virus, which we as blood cancer patients are never to take. So the old-fashioned shingles vaccine, the older one, that's a no-no. There's several. The measles, mumps, and rubella shot we should not receive, as a blood cancer or an immunocompromised patient. Then you have the next group of vaccines, which are inactivated viruses, but they are particles from a virus. But this is a DNA that signals our body to think that we've been exposed to the COVID virus, but there's no virus. So it's a totally different mechanism. And the thing about the influenza vaccine is that depending on the vaccine, if you got the trivalent shot has 3 strains of influenza in it, and the quadrivalent has 4. So people over 65, they recommend the high dose quadrivalent, but that's only 4 strains out of hundreds of strains of influenza. So the thing about the influenza vaccine is there's no vaccine that protects against every strain of influenza. So scientists put up their best guess, and that's really all it is what do we think we're going to see next year? And that's what they put in the vaccine. And so you could actually still get a different strain than what was protected by the vaccine. But most people that, for one, it takes 2 weeks to develop, a minimum of 2 weeks to develop immunity from the vaccine with flu. And it's 28 days with the COVID after the second shot. So, you're looking at from your first shot to when you potentially can be immune is 56 days. So somebody gets it next week, they're not going to be immune until the last part of January, early February. So, they're not the same. Influenza, yes, you can still get a different strain. So typically the trivalents have 2 influenza A and 1 B, and the quadrivalent have 2 A's and 2 B's. But there's, like I say, there's hundreds of different strains of influenza. So it's kind of a crapshoot. It's kind of a gamble. I don't have a problem with it. I've been getting it for years. It was mandatory in the military. It's been mandatory when you work in a hospital. If you work in a hospital today, the hospital can't be accredited if they don't have a policy that says any employee that refused to get the flu shot will have to work from October 1st until April 1st every year. So, so it's an interesting thing, but I'm not afraid of the new vaccine, and I'm not negative on it. I did want to say that with what Kenny kind of said, you guys sound like you're down on the COVID vaccine. It's not a matter of being down on it. I just like to know, I like to see a little bit more data on anything that's going to be used. So I'm kind of grateful in a way that we're not in that first group like they are doing in the UK. So we're not going to be the guinea pigs, because the studies have only had like 40,000 people in them, and a typical, drug clinical trial will have hundreds of thousands of participants in the clinical trial. So, we don't know all the side effects that potentially. They say headache is pretty severe for people, and that injection site pain is pretty common, and fatigue. So there's many people that, were part of the clinical trial that said they basically slept for 24 hours after they got the shot.
Well, that was the initial shot too, because I think it's still a 2-shot treatment. Yeah. And I think it's like 30 days apart, right?
Yeah, 28 to 30 or something like that.
Yeah, something like that. So, but the way I see it, I mean, and again, I guess I'm trying to be glass half full here. The way I see it is, if that is, this might be an initial, what did they say? I think I saw that they're going to have like an initial, I don't remember what it was, like 50,000 doses for 25,000 people or something like that by the end of the year. This may, you know, from one pharmacy. But I think potentially what that allows for is to at least get something out there to some people that we know at least is effective in combating something. So it's a start. And these drug companies haven't stopped doing research on trying to do a one-shot drug. I've seen that several of them who have done the 2-shot. They're actually still working on a single-shot drug. So at least at least to me, it's a stopgap. It's a opportunity. So I hear you on the.
Yeah. So one of the interesting things that, you know, just doesn't make sense is, you know, that you have the Pfizer product and then you have the Moderna product. Those have been basically, the data's been released, and both of those had roughly 95%, you know, effectiveness. But then there's another company, a British company called AstraZeneca. And when they gave full strength vaccinations, the two of them, they only got 70% effectiveness. But if they cut the first dose to half dose and then gave a full dose the second time, it was 95. So that's really strange. I can't wrap my head around why that would be. But yeah, so and they're not close to to asking the FDA for approval or anything yet. They're still in the middle of their clinical trial. But I just thought that was fascinating that, you know, by playing with it, they were able to figure out, hey, if we give a smaller dose for the first injection and a larger dose for the second one, we actually get more effective, antibody production, which that's crazy, but hey.
That's really crazy to hear that.
Yeah.
And then have both Pfizer and Moderna done that and tested it that way, or just another company?
I mean, they had the 95% with the same dose for both shots. You know, I don't know why AstraZeneca, maybe because they weren't satisfied with 70, said, hey, let's try different combinations. And, you know, I haven't actually gone in to look at what that clinical trial looks like. You know, and what the different arms of their study were.
Have they tested what happens with only one shot? Because getting people to do 2 might not be so easy to get them to come back.
Yeah. Not, you know, my understanding is that we don't get a good enough, antibody response with the single, and nobody is proposing a single shot. And what Kenny was saying about, you know, like nationwide between now and the end of the year on the Pfizer product, they're talking 20 million doses, which will be able to do 10 million people. I think that that's a lesson learned from the Shingrix vaccine, where they really, really promoted it. And then when it came time for people to get their second dose, they didn't have any. They couldn't keep up with the demand. And so I think basically what they're going to do is they're going to set aside your second dose for you once you get your first, and, you know, so that you're guaranteed that you'll be able to get it. So I think that, you know, that'll be helpful. But, you know, we're certainly not out of the woods. As I say, somebody gets it next week or the week after, it's February before they have the antibodies to fight it off. So
it's really crazy times, because the other thing is, everyone will not be getting it just because a lot of people are anti-vaccine. So when that happens, how are we protected as a population if there are still people out there who are getting COVID or get COVID?
So, you know, there was a lot of negative press about it earlier, but there is a phenomenon called herd immunity. And so with most vaccines, when you reach about 65 to 70% of the people having received the vaccination, the virus tends to die on its own and the spread does diminish. We could never have reached that by letting people become infected. You know, 60 to 70% of the US population is a lot of people, you know. What do we have, 390 million people, you know? So, you know, we've talked about having, what, 2 million cases nationwide. We would have to have 200 times that in order to have herd immunity. So the vaccine potentially, you know, that's how we wiped out polio. That's how we wiped out, you know, many of these childhood diseases that, you know, we no longer have to vaccinate for here in the US, unless you're going to travel to an area that still has those diseases.
So Tom, do you know how many people get the flu shot annually, like every year? And I heard it's only like 40%.
That's probably pretty accurate, Al.
So are we going to be able to control the COVID with people, you know, because not everyone's going to get the COVID shot.
Yeah, I think that, you know, as we can approach the higher numbers, 50, 60, 70% having received it or have had COVID, you know, they will have the antibodies too. One of the things we don't know is how long does that immunity last? So that's kind of an interesting thing. So, you know, I used to be a volunteer fireman, and so years ago, because I was an emergency medical technician, one of the things they wanted everybody to get was a hepatitis B vaccine, and that was a 3-shot series. And when that first came out, they said, okay, this will provide you with immunity for 3 years. And then a couple of years later, they said, okay, it will provide you with immunity for 5 years. So they didn't have enough data to say it was going to be more than 3 years at that time. You know, the clinical trials had not been going on that long. So we really don't know. You know, right now, somebody that had COVID in February or March, how many of those people are going back in and having the antibody test? There's not a lot of people that are doing that. But if we did that, then we could start to, and I'm sure they're looking at that kind of stuff to say, okay, how long will the immunity that we get if we've had COVID last? So I don't think there's a set answer, Al. I think that, you know, I don't think we're going to return to, you know, situation normal at all in 2021. We're not going to be back. I'm not going to be back on an airplane 100 times like I was last year. You know, I mean, you know, normally I would be going to New York to see my kids for Christmas, and I would fly. And I said, under no circumstances would I, you know, even if New York didn't have restrictions, would I drive to New York 24 hours, you know, and, you know, potentially get snowed in. I mean, you know, one year we had 32 inches of snow on Christmas Day, you know, and it's like, it's pretty nice and warm down here in Florida. I think I'll stay right where I am. You know,
I don't know if any of you have noticed, here in Arizona, we get a lot of tourists.
Yeah.
So there's a lot of Asian people.
Mhm.
And even before the COVID, the Asian people have always worn masks.
Yeah,
True. Here too.
yeah, that's correct.
For years, like
They're out in
way.
public, like in a plane or at an airport, many of them wear masks. You're right.
Anywhere there's a bunch of people, they'll wear masks.
Yeah. Well, you know, I think one of the things that we're definitely going to see as a result of all this COVID is I think we're going to see less flu. Think about it.
Yeah.
Have all of those plastic barriers now between us and the cashier. You know, if that cashier, you know, in a hospital, they always told us, if you feel sick, we will pay you to stay home. If you have the flu, we will pay you to stay home because we don't want you coming in and getting our patients sick. You know, but how many people that work at Home Depot that live paycheck to paycheck can afford to take a day off if they don't have any sick leave? You know, so they go to work and they don't feel good, and they're huffing and puffing and coughing and sneezing and wheezing, you know, all over you. And so I think those plastic barriers and stuff will cut down on a lot of transmission, common cold, influenza, other diseases. So I think that those kind of protections are here to stay. And
That's what I was wondering, like if we got to the point where we'd eradicated COVID, like are
Yeah.
all these barriers are still going to be there?
yeah, I mean, I think it's not a bad idea. You guys were joking, but I went on Black Friday and got my nails done because all the ladies were out shopping and there was nobody at the nail place. And they have these plastic barriers between you and the manicurist, and all you do is you stick your hand in underneath the barrier, but she's not there, face to face with you and stuff like that. So, but I just think that there's going to be, a lot more. I think
We'll be healthier, sort of?
might be, I think people are aware of the transmission of infectious disease more than they have ever been.
Our long-term care, personal care homes, I think in Winnipeg here, 30-something out of 40-something, they've been just terrible, like hotspots for COVID.
Yeah. And
I haven't heard that much from because here we get ABC, NBC, we get all that, but we don't all those what are they called? The American channels, because we're on the Canadian side. But I don't see that much on the news about the care homes on your side of the border. Whereas here, there's like a lot of, right now, we have Red Cross Society personnel will be going into our care homes to help the staff there. Like our ICUs are 95% full and our care homes are hotbeds of COVID. So what I'm finding also a little stressful is my mother-in-law has dementia. She's in assisted living, and up until our lockdown, my husband was taking her out like for a car ride, 20 minutes, half an hour a day, which really seemed to help her agitation. Well, now since this lockdown, she's not even allowed out of her apartment.
Mm-hmm.
And she's gotten worse. Like her dementia symptoms Dave never knows what he's going to see when he gets there. And that's another stress. Like that's concerning to me is these people that are, well, whether it's just a mental health thing, but we're all stuck indoors.
Yeah.
And then when we go out, are we going to have, like, if they don't keep wearing masks, then what kind of protection are we? I don't even know how to voice my concern.
Yeah. So, I mean, here, assisted living and skilled nursing facilities account for about 35% of the deaths from COVID. I have a friend who's the director of nursing at a assisted living dementia unit about 40 miles from here. And they've had 2 COVID positive patients brought in by staff, but they were able to isolate that down and stop the spread within the facility by not allowing family to come in and visit and things like that. So, I think that some facilities have been kind of wide open and some have been, more restrictive. We've had cases where nursing homes were told that they had to take a COVID positive patient. And then, they early on in the disease, but they didn't have the safeguards in place to prevent the spread. So it's been a learning experience for sure, but no easy answer.
Right. Well, she's been on a waiting list to get into a care home that has a dementia memory care unit.
Yeah.
And I think that's over a year. And we were told the waiting list was like 2 years. But now and that was before COVID. But now with COVID, my husband doesn't want to put her in there anyways because we wouldn't be able to see her because of that's what they put in place to keep the COVID down is that we can't go see her. So like my grandkid, my grandkids ask, how's Nana? And, you know, like, well, she's fine. She's about the same, but like they haven't seen her for 8 months.
Yeah.
Okay, I'll shut up now. So you guys, I see that you guys are waving over there, just back and forth.
Oh,
Kenny was leaving us, but I just realized what time it is.
Yeah.
Time flies, having fun. I do think we need to wrap things up, but I just want to make sure that if anyone had any personal things they wanted to share about any of their concerns with their disease or life right now, that if they have anything more to share, that they do.
Well, Michelle, I certainly would wish everybody, just a wonderful holiday season. We have a lot of challenges ahead of us in the next month or so, emotional challenges, and it's not going to be easy. And so I wish you the very best during this season, and I hope that you're able to make something happen in your life about it. So God bless, and we will see you until next year.
yeah.
Oh, there's no meeting beginning of December?
This
We
is
are-
the beginning.
This is the beginning. Oh, yeah, Susan, she's got,
No, she's in Canada, remember?
Oh, that's right.
Oh, he's from Canada.
He's in Manitoba. It's a different time.
I go, exactly, it didn't even,
Different
it
month,
just went
it's a different month. in
7:47.
Manitoba.
You're on a different calendar.
Just on a different
It's-
brain level.
It's
Yeah.
I got a
okay. We
question.
have that from time to time.
I
How's
got a
that
question for Richard.
Yep.
How do you feel about the COVID shot?
Well, I'm optimistic without, I don't have the scientific background that Tom has, but, good God, if it's able to be distributed, and there is some possibility that it's going to work, man, I'm all for it. I have an emotional answer for you, and that's, I had a grandson who was born 4 weeks ago, and I've had 2 hours to see him and hold him, and it's killing me. So, thank goodness for, pictures and on your cameras and that kind of thing. But, our life has been so disrupted that if it makes a difference, and I can't tell you whether it's going to make a big difference or not, but I'm assuming it'll make some. And maybe I'm being naive, but my prayers every day are to ask the good Lord to make it work.
One of the things with having blood cancer for me has been a real positive is to maintain an optimistic outlook on the disease. And, so when I mentioned earlier that I got interested in that one clinical trial of the combination of the two drugs, 75% of the patients in that trial, which was a small trial, it was less than 100 people, reached undetectable and MRD after a year to 18 months. And I said, I want to be in that 75%.
Yeah.
And I made it in 6 months, and part of the reason for that was I had been on the first drug for 4 years, whereas most of the people that start out with one for a month or two and then start the second one. So I had already reduced my tumor burden from 70% of my bone marrow lymphocytes being cancerous down to 10 before I started treatment, But that drug, the first drug I was on, was never going to wipe it out altogether. Ibrutinib is a drug you go on until one, you either can't tolerate it anymore, or 2, your CLL comes back. You know, so I just had that opportunity. So that sense of optimism. So Richard, I share with you, you know, optimism about it. And that's going to create a whole new thing is, will we be able to say to people that have had the shot, okay, you no longer have to wear a mask? Those are all, nobody's answering, you know, those questions because a lot of these decisions are being made by politicians,
Oh,
not by scientists and doctors. You know,
Yeah.
and you know, and some of them are a little bit hypocritical. You know, we have you know, on the news, you know, today they're talking about the mayor of Austin was telling all the residents of Austin, you have to stay home, and he broadcast a Facebook message from his condo in Mexico.
oh, wow. Oh,
Our premier of Manitoba tonight on the news, he said, he called people who won't wear masks idiots.
Yeah,
I'm like, this is you,
but if
we're
but
not
if
used to
somebody's already
hearing.
had COVID, do they
things
really
like
need to
that.
wear a mask? You know, that's another question that we need to answer. You know, so there's going to be a lot more uncertainty, but somebody's got to take some, you know, responsibility instead of saying, okay, this is not a political situation. This is a medical situation. Let's get the politicians out of this.
yeah, amen. You know,
Yeah,
if the former president,
let's get the politicians and the mainstream media, and let's start listening to our doctors, and we'll be happy.
amen. I think the good psychiatry movement, never mind.
All right, guys, I think we got to wrap it up only because I think the FDA may step in.
Uh-oh.
The FDA could come in and close us down if we don't step in.
You know, in Boston, the FDA delivers wine.
Really?
Hey, it's Boston, you know. Come on, Tom, you're from upper north. You know
It's on
Boston.
video.
With my own 2 eyes.
No, it just shows that the FDA delivers some good things that, you know, you can't always say bad things about them.
No,
It's on YouTube now.
Exactly. No,
Right now, FaceTime is my friend. As a grandparent, I FaceTime with my four out of my 6 grandkids. So Richard, when your youngest one is a little bit bigger and I had Saturday night bath time with my 5-year-old granddaughter. We actually FaceTime while she was in the bathtub.
Yep.
And if you think that didn't lift my spirits
Yeah, I know.
way up there, it
Yeah.
was both Dave and I, we just laughed and laughed and laughed.
Yeah.
So
all right, well, listen, I'm going to leave you.
You do.
I'm out of my depth here when it comes to grandkids and bath time. So I
Happy
gotta
holidays.
Thank you.
Happy holidays to all you.
Happy holidays.
Happy holidays next year.
Bye.
Michelle, can I see you sooner than that?
We can, yes, we'll have to text about it. Take care.
Okay. Yeah, love you all. Have a great month.
You too.
Okay, bye.
Bye-bye.